Dr. Pam, how are you? When I get a question a couple of times, probably means that I need to make a video. So I get this question so often of whether or not I should take the NCHMC or the NCE. Now, let's be very transparent. It depends on your state. Some states require both. Some states require one or the other, and I can't determine what your state requires. So that's between you and the board. And if you're not sure, be sure you go before the board and you ask them which one that you need. But I get people that in some states that you can have either one. So let's talk about the difference. If you watch my prior videos, I have said all day, every day, I love the NCHMCE. I adore it, but I'm a clinician. I'm excellent at diagnosing. I'm excellent at treatment. That's my expertise. I always get dinged on this on Facebook, but I love the crazies. I love pathology and love how understanding how it works and the treatment. For example, no matter what test you take, we know that when it comes to any mood disorder, that's depression, that's anxiety, that is bipolar 1 or bipolar 2, CBT and meds is the right answer. No matter what test you take, that's the right answer. And remember, the test doesn't really care what you do in your office. Nobody ever asks what happens in your office. It's a matter of what does the test want you to answer. So as we look at my screen, let's talk about some of the differences and how you decide if you have an option, which one you should take. So the NCHMCE has the long vignettes. It's a reading test. No matter what test you take, it's a reading test. But this one, you have to go back to the vignette, back to the vignette. It's going to give you the diagnosis or a provisional diagnosis. You might have to do some differential diagnosis. If you are really, really good with diagnostician, if you're a good diagnostician, this is the test for you. If you can tell the difference between OCD and OCPD, you know, the difference between a conduct disorder and an oppositional defiant disorder off the top of your head, this is the test for you. That's simple. That's simple. If you're struggling with either one of those terms, then you probably need to take the NCE. The NCE is not very heavy in diagnosis. You're not expected to be an expert diagnostician on the NCE. There's about 4 or 5 questions, maybe 6, but I can tell you based on my expert opinion, I think about 2 or 3 of those count. So if we look at the NCE, it is again vignettes. There are 10 stimulations between 55 and 65 scored items plus the unscored. It doesn't take away points anymore. Back in the day when I first started tutoring, you lost points if you got it wrong. It doesn't do that anymore. So I like that point. The pros are it closely mirrors real world counseling practice. So if you're working with a client or a family or a couple comes in and you have to figure out what to do with them. Highly valued for LPC licensure in many states. It really depends on what state you're in. The test applies knowledge of diagnostic interventions and treatment planning. You're going to get very few research questions, maybe a couple diversity questions, and probably 1 or 2 career questions. Okay, but it's very high. Are you a good diagnostician? And do you know this is how we treat people based on this diagnosis? The cons, again, you have to be very, very good with the DSM. You have to know that bipolar 1, right, is minimum of 5 to 7 days off the chain behavior. The higher the highs, the lower the lows. If you watch my video, and I don't think he watches me, but I'll say Kanye West, right? Definitely that when his behavior is so bizarre, we know that's a full-blown manic episode. I have to know that schizoaffective disorder is 2 weeks. It looks a lot like bipolar 1 with psychotic features, but it's 2 weeks of having the bipolar 1 and having psychotic features as well. I have to know that. And if you're very good at that, if you work in an environment where you have access to diagnosis and someone that if you're diagnosed already, if you're good at that, this is the test for you. It says time management is critical. I'm going to say that for both tests. Both tests are considered power tests. Remember, so on the NCE, that's a question. A speed test is based on can you get this many questions in at a certain time. Back in the day, for old people, it was based on how fast you could type. I know. You didn't have typing classes, okay? But when I went to high school, when the dinosaurs roamed the land, there was the one-room schoolhouse. I took typing classes. Wasn't very good at it, but whatever. It's more subjective and less emphasis on recall. So the NCE, you'll have more recall, but you still have to know the theorist on both of those. If I talk about narrative therapy, you have to know that a narrative therapist says you have this story that you've constructed in your head, right? And now we're going to externalize, we're going to take it out of our head, maybe give it a name. We're going to take it apart and we're going to reauthor the story. You have to know that the therapist is a collaborative. She wants to use your own words when it comes to reconstructing your story. You have to know that for either test. There's no easy way out. I personally get frustrated when people want an easy way out. They just want test questions. And if you watched any of my videos all day, every day, I'll tell you once you learn content, test questions are easy, but you have to learn content. You have to learn that solution focus is the one theory that doesn't follow the medical model. The medical model means when you go to see your doctor, the doctor says, hey, what's wrong? Solution focus says, hey, what's right? I only have 3 to 5 sessions in a solution focus, and I'm going to focus on the miracle question. If you woke up tomorrow when the problem was not a problem, the scaling technique on a scale from 1 to 10, what's your 10? Because every time I come in, my therapist is going to ask me how close am I to my 10? And I also have to know the accept question. When is the problem not a problem? I have to know the verbiage of the theorist no matter what test I take. I just have to know content. Remember, this is what you do all day, every day. If you tutor with us, we'll remind you, you just can't bring what you do into the test, but you do everything we talk about. Most of you have used Carl Rogers. You have set up an environment where you used non-judgmental attitude, right? Unconditional positive regard. No matter what the client said, you didn't freak out. So my Ncmce is going to have definitely more the longer vignettes, and the NCE has those short questions. So remember, there are 200 questions, only 160 are scored, there are 40 unscored. Also, remember that if you're taking the test, I'm recording this in August of 2025, that it's broken into 2 sessions. You get a 15-minute break. You can't go back to the first 100. And in the first 100, according to test, retest, or split half reliability, which is the Spearman formula, test question, that the first 100 and the second 100 measure the same thing. So I get her all the time. Oh my gosh, the first 100 was harder. The second 100 is harder. According to statistics, that's just not possible. It means that if there are 40 test questions that are not scored, there are 20 in the first half and 20 in the second half. On the NCE, there are the assessment questions, right? There are between 30 and 36 in assessment. And most of my clients freak out. Can't do that. These are the easy ones. If you tutor with us, we'll remind you, these are the easy ones. It's just memorization. The same way that you were in 4th grade, you learned the mean, median, and the mode. Same thing. It hasn't changed. The 68, 95, 99 will never change. Math has rules. You won't see those type of questions on the Ncmce, but don't be scared. I say scared because we can teach you those, and it's just memorization. The same way that you learn 3 times 3 or 12 times 12, the same way that you learn those, the same way that we're going to teach you the assessment questions. There's a couple of research questions on both tests. 3 to 5 max. The 3 to 5 will talk about the nominal, the ordinal, those kind of things, right? How we measure things. You might get some questions on independent or dependent variables on both tests. So both tests are minimal in research. If I take the NCE, it covers a wide variety of counseling content. I have to know my theories, my ethics, my stats, but I do have to know my ethics as well for the NCHMCE. There are no vignettes. I personally like the longer questions. When I get those one-line questions, I want to scream. If I don't know what they're talking about, I'm out of luck. And you know that both of the tests are still going to be very, very vague. If you're looking for a test question that says, according to Gestalt, or who does the empty chair belong to, you're not going to find those on either test. And I will say to you always, I'm not a fan of the purple book right now. I say, once you learn everything, go back to it. And I understand that many of your therapists, many of the experts, your colleagues, your professors say, go to the purple book. It is great for content. I am not going to lie. Definitely, Rosenthal, I'm going to give you a high five for content. However, that's not the way the test questions are written. Prior to the middle of COVID, which is March of 2019, it was great. It was great. It was just recall. Name Freud's 4 stages, but that's not what you see now on the test. You'll find that we talk a lot about Bloom's taxonomy. Those are your cognitive, right? How you learn. And much of the purple book is written just on the recall level. And it doesn't apply to many people. What I hear is, I studied the purple book back and forth. I studied the whatever book you studied back and forth. I've taken test questions all day long, but I still don't pass the test because you haven't learned content. And remind you that we will never, ever, ever sell you a book that talks about content. We suggest that you tutor with us, let us teach you the content. Stop buying materials. We're always going to say, buy tutoring sessions. Stop buying material. Let us teach you what it looks like. Anyway, my smart kids, you're the ones that are here because you have never learned how to study. Most of the clients, all the clients we tutor, graduated top of their class. They have a 4.0, a 3.987, blah, 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 because you learned to BS your way through grad school. Let's face facts. However, you did not do well on the GRE because you do not have standard test taking skills. No matter what one test that you take, I'm going to teach you how to take a standardized test that everybody takes. The cons is it tests breadth over depth. It is 6 years worth of content. Both of them are, though, remember? So if you use writing notes, if that's how you got through grad school and you think that's going to work for you on this test, you're going to find that it doesn't work. If you spend time with us, watch our videos, I'm going to make you put down your pen. I talk too fast. I try to just spill everything I have in my brain. I try to brain dump everything I have in every session. But remember, the goal is not to take every word that I say, but to listen to what I say, mindfulness, be in the session with me, enjoy the session, and go back later and take notes. Everything we do, we record. Every video that we have is free. Not every video, but if you're using our free videos, then they're there. If you have paid video, it's still yours. It's yours forever. So when you're with me, stop taking notes. Stop trying to be so perfect. What we know is many of our clients, the stats say 1 in 4 of professionals are OCPD, my perfectionists. I find that a much higher rate in the clients that I tutor. You just want to be perfect. And if you're trying to be perfect, very black and white thinking, you're going to struggle with this test. It's very, very gray. Okay, so in the NCHMCE, this is a typical scenario, and this is a shorter one. Most often, you'll get the first session, you'll get the MSE, you'll get the presenting problem. So Maria is a 42-year-old nurse, and she reports she's constantly on edge for the past 6 months. She experiences a muscle tension, frequent headaches, difficulty sleeping, trouble concentrating at work. She denies panic attacks, but she says she can't relax, even on weekends. She starts avoiding social events because she feels restless and irritable in crowds. She drinks 2 glasses of wine most evenings to wind down, but she has no history of substance abuse. Okay. So then, no history of psychosis. So we're going to look at what? Her last medical exam was normal. So my first question is assessment. So remember on the NCE and as well as the Nchmce, we always start with assessment, right? We get paid to be nosy. We're going to keep asking questions. So what is the most appropriate next step? So I'm going to go back and look what I know about Maria, and I'm going to figure out what should I do first. A, initiate relaxation techniques immediately. B, conduct a structured assessment for generalized, anxiety disorder. C, explore PTSD triggers. And D, refer for a sleep study before any counseling. Now, remember, I get paid to be nosy. I'm going to ask questions before I intervene. That's what I do. That's what your psychosocial assessment is. I'm going to ask questions. I'm going to ask questions before I intervene. I'm going to go back to the question to prove my answer. Do you see anything in there at all that she had a traumatic event? I cannot say PTSD. PTSD, remember, acute stress disorder is 3 days to 30 days. A PTSD is going to be after 30 days. There's nothing in this scenario for me to even think about that. I'm going to take out C right away. I know that she's irritable and she's got some muscle tension, but the biggest issue is not that she can't sleep. So I'm going to take out D as well. So again, so now I would be between A and B. And going back to the question, I know that generalized anxiety disorder lasts for 6 months. Free floating anxiety, not tied to anything. I'm going back to the question, and the question says for the past 6 months. Did I mention it was a reading test? They give you hints and clues in the question. So, of course, B is my best answer because of the hints and clues and basically what I know about the DSM. Okay. So now my second question is based on the available information, what would I diagnose her with? Oh, what? What? Did they give me some hints already? Of course, it is GAD. So let's talk about the others. Whenever you're using test questions as study material, which I don't recommend, I'm going to go through and make sure I understand all of them. A panic disorder is different than a panic attack. A panic attack means I've had one incident of tachycardia. By the way, I've had a couple of panic attacks. So not recently, thank God, but you think you're dying. You think you're dying. Your heart is racing. People find you, besides you can feel it. It's pounding. Your chest is pounding. You go to the emergency room and do all these tests, and there's no medical reason behind it. I'm not having a heart attack. I'm not having a stroke. I'm not dying. It's my own emotional disorder. So a panic attack is real. It feels real. My heart is racing. The panic disorder is I've had one panic attack and I spend the next 30 days worrying about having another one. The question may say something like Pam sleeps in the hospital parking lot because she's afraid she's going to have another one. Social anxiety disorder is going to talk about not liking to be around people, that I am afraid that to give up public speech, I don't want to be in crowds. I may have agoraphobia. Agoraphobia is the fear of leaving my house, and having a social anxiety disorder with that, or also having agoraphobia with a panic attack. An adjustment disorder is 6 months. It's going to say in the question, something happened, and I'm adjusting to what happened. It can be I lost my job, I got a divorce, and something happened. I can have an adjustment disorder with both anxiety as well as depression. My differential diagnosis. So remember, all that means, again, is I have to differentiate what makes this different than the other possible diagnosis, because a lot of them look alike. And it says, which additional information would best rule out panic disorder? And I said to you before, I explained to you the difference between a panic attack and a panic disorder. So, of course, B is your best answer. Okay. Your initial treatment goal. No matter what test I'm taking, I have to do treatment planning. I have to remember SMART goals: specific, measurable, achievable, realistic, and time-based. That's what we do. No matter what test I take, I have to know this material. And remember, my treatment goals, my SMART goals, are based on my treatment plan, my theoretical orientation. So this one says, which goal is most appropriate? Eliminate all anxiety symptoms within a week. Wow, that'd be great. You got a magic wand? I'll take that. B, reduce muscle tension and improve sleep quality. I like that one. C, stop all alcohol use immediately. Or D, resolve all workplace stressors. Let's go back to the question. Let's talk about her alcohol use. What did it tell me? It said that she denies panic attacks, but she can't relax on weekends. She has started avoiding social events, and she drinks 2 glasses of wine most evenings. So I don't want her to stop drinking immediately. She can get the DTs, the delirium tremors. If someone is an alcoholic, they need a medical detox. So I'm definitely going to say, I'm not going to say just stop using alcohol, because if she dies, her family's going to sue me. That's not a test question. But remember, I don't want them to sue me, and I got to live with that. And that's out of my field of expertise. My program didn't teach me about medical school or about the DTs. So whenever I see resolve or fix all or none, those are always questions that remind me that can't be the answer. There are very few things that are all or none. And those of you that are in practice, you know that treatment goals will be measurable. Pam will shower 3 times a week. Not every day, not all day, every day, but it's going to be very specific. So given my choices, I see all and I see all. So those are red flags. Red flags, no way, no how. Okay. So reduce emotional tension. And again, a SMART goal, if it said, it gave me some numbers, that's what I would look for on both tests. Remember that. My intervention selection. So which intervention best aligns with evidence-based treatment for GAD? I said to you earlier, any mood disorder on either test, it's the same answer. The only evidence-based treatment that we have is CBT. That is Beck. Beck says you got some stankin' thinking, girl, right? You've been using some mind reading, some overgeneralization, some magnification. All of those are terms that belong to Beck's cognitive restructuring. You might see questions that are evidence-informed or studied. So we know that DBT is evidence-informed. It's an offshoot of CBT, right? So we know that it's evidence-informed, but the only theory that's truly evidence-based is going to be CBT, and that's the treatment for any mood disorder. Exposure therapy belongs to my phobias, right? Joseph Wolpe talks about systematic desensitization. I do it slowly, or I do it flooding all at the same time. If you're afraid of spiders, I just put you in a room full of spiders. I don't see anything in the question about a phobia, so that can't be it. Psychodynamic is Freud. So I'm pretty sure we struggle with evidence that proves what's in my unconscious. And if you can prove what's in my unconscious, you let me know, because Freud's theories were subjective and projective. You're projecting from your unconscious onto the TAT or the Rorschach. But I'm pretty sure when he analyzed my dreams, it was not factual. It was what Freud thought. So now I'm between B and D. And again, I'm making sure that I know vocabulary, that I understand what they're asking me. Aversion therapy, my official diagnosis, is anything yucky, painful, or gross. Exactly. Aversion therapy came from conversion therapy. Back in the day, when being gay was a DSM diagnosis, What we would do is we would hook up men with the electrodes, and they would show them a video. And there was a video of other men. And if their heart rate went up, if their respirations went up, they would shock them. So, aversion therapy is anything yucky, painful, or gross. We can go back to the day, and most of you, we had that thick rubber band. And if you had automatic thoughts, you'd flip that rubber band and it hurt. It hurt. We can talk about anti-abuse. Anti-abuse is the patch or the pill that you take. If you're an alcoholic and you take it and you drink, you're going to vomit across the room like that. Okay, so that's aversion therapy. We can go back even further. If your mother put hot sauce on your thumb, so you stop sucking your thumb, it hurt. That's aversion therapy. My official description of that is anything yucky, painful, or gross. Okay, that's aversion therapy. There's nothing in the question to prove that. And I do know that my answer, of course, is B, because I know that's the evidence-based treatment. A lot of you that are listening now have been with me, and I always talk about test accommodations. I'm a huge fan of accommodations. You can't say that you have test anxiety. That's not a real thing. What you have is generalized anxiety that you've paired with the test. That goes to classical conditioning. Remember, that would belong to Pavlov. He says you've paired two things together. If you watch any of my videos on classical conditioning, when you first started college, you knew you had to take a test, but it did not create any anxiety. But as you have graduated or coming close to graduation, and you're on Facebook and you've read on the Facebook chapters, oh my God, everybody failed, your anxiety is up because you've paired it with a test. By the way, I'm going to say, you follow us on Facebook, Addict and Coaching, you'll find that most of our clients pass, they don't fail. And if you're using another Facebook page, if you're tutoring with us, I will tell you, stay off social media the month before you have the test. Just stay off. Just stay off, stay off. There's no reason to taking this test over and over and over again. There's no reason for it. It's a hard test, but it's doable. Let us teach you. Stop spending money. Stop buying more materials. Just let us teach you based on materials that you have already. Okay, so CBT, of course, is my answer. And then ethics. Oh, I've got ethics and culture. Again, both questions will be on both tests. Maria asks you to write a letter for her employer stating she should be excused from public events indefinitely. What should you do? What? No, I'm not going to sign a letter that for the rest of her life, she should not go to any public events. And my thought is you need treatment, Maria. And I might write a letter that if she agrees, if she signs the release, that Maria is currently in treatment and we're working on her issues, but I'm definitely not going to write a letter that says indefinitely. And remember, whenever you have a release of information, it also should always be dated. It's either 6 months or a year. That's a common time for a release of information. So B says, agree and send the letter immediately. Write the letter, but omit the diagnosis. Or D, suggest she request a letter from her primary care physician. So I should have been down between A and D. Okay, that's when we get down to 2. That's where I'd like to be. Okay, but the best response is she asked me. What's my response to her if she asked me? Sorry, Maria, I cannot write that. That's the best response to her. So, cultural considerations. Maria shares that her culture discussing anxiety is viewed as a weakness. How should you respond? Whenever there's culture in the question, I'm looking for an answer that discusses culture. Always, always, always. That's a hint in the question. Did I mention it's a reading test? No matter what test you take. So I'm not going to avoid it. We don't ever do that. Not okay. And if you're taking the NCE, the term broaching is definitely on the test recently. This is again 2025. Broaching says if there's some cultural issues, I'm going to bring it up. I'm not going to wait for her to discuss it. I'm going to say, hey, I see that you are Hispanic. I see that you're Latino. I see that you're red, black, blue, whatever. How does that affect you? Broaching, it means we're going to talk about the subject and invite the client to discover it. So encourage her to ignore cultural norms. I'm not going to do that. Woo. Okay. And I'm not going to correct her perception by providing facts. So absolutely, I'm going to explore her beliefs. I'm going to ask more questions about her culture. Okay. Which of the factors most reduces immediate safety concerns? Okay. So if I talk about risk factors and dynamic factors, risk factors are the fact that growing up a home that I'm higher risk if I don't have a job. I'm at higher risk if I don't have a strong family support system. So if I'm trying to look at what most reduces her immediate her safety concerns, and remember, my immediate concerns are always going to be safety. I don't see anything in the question that says that she is about to kill herself or has any suicidal thoughts. So A is my best answer. Okay, so again, it goes down through the tools that you would use, the GAD. So GAD is generalized anxiety disorder. Many of my people have taken the Ncmce. There's a whole list of assessment tools. Don't learn all those tools. Just read. Just read. There's nothing in the question about depression. The MMPI measures your level of crazy, and the SCL90R is not one that I would use. I wouldn't even teach you that on the test. If everything else doesn't make sense, you can put that one, but we know that this one is the GAD. And of course, termination starts at the beginning. So termination starts when she meets her initial goals, or she starts to meet her initial goals. So if we look at the NCE and the same kind of thing, you're going to see, again, those one-line questions. I prefer vignettes all day long because they give me more. But with my one-line questions, if I don't know the answer, I'm lost. This is a code of ethics question. A client accepts a handmade quilt from a long-term elderly client as a goodbye gift. The most ethical action is, can I tell you how many times I get, the test does not care about your agency. There's nowhere does it say at my agency or my name, my address, my social security number. It's based on the ACA code of ethics that everybody reads no matter where you live. The code of ethics talks about cultural consideration. There's a couple of hints in this one. It's a long-term client and she handmade a quilt for me. I'm not going to say, I'll tell her that I can't take it. I'm going to always remind you, if it's about food and ethnicity, I'm always going to take it. If I draw you a picture of your dog, take it, frame it, hang it up, more power to you. But if your client is a budding artist, you can't take it because that picture may be worth something one day. Let's pretend, Dr. Pam has no rhythm, but I'm dropping some beats. Sound like that, right? Dropping some beats. If I drop you some beats, you can have them. You can have them all day long. But again, if I'm working with someone who may be a famous artist in the future, I cannot accept that. Let's be careful about the monetary value. So food and ethnicity is always the right answer. Always, always, always. Human development, you'll see this on both test questions. So according to Erickson, a 45-year-old client is exploring the ways to contribute to their community is in which stage. Remember with Erickson that he talks about crisis, that I may be stuck in a stage. Freud uses the word fixated. If I'm fixated in the oral stage, right, that means my mama didn't satisfy the sex in my mouth. But Erickson talks about the stages. Don't try to memorize those because I can be 25 or 35 or 45 and still be stuck in trust versus mistrust because I never learned to trust anybody. Learn the content. So a typical test question, my 45-year-old, that's the stage that I'm in. That's generativity versus stagnation. So generativity means I'm like still chugging away, trying to get the mountain, trying to leave a legacy for future generations. I'm trying to make sure these videos last forever. And when I'm dead, you can still pass the test. I say to you that whether I released a video 10 years ago or yesterday, they all still dead. Freud did not come back to life and write any new theories. So generativity means I'm trying to leave a legacy, and stagnation means I'm done. Put a fork in me, I'm done. A lot of you have had college professors that are done. They're done. They've used the same test for the last 5 years. You can ask your friend that took the class 2 semesters ago, the answers to the test. They're done. Okay. So remember, Erickson said it's either or. I'm going to try to continue to work, but if I'm stagnated, if I can't get to the last stage of ego integrity versus despair and live my life and look back on my life with integrity, if I haven't gone through all the stages. Oh my gosh, Dr. Pam, there are 1,000 group questions. There are not, but definitely on the NCE, you have to know your theorists. You have to know I'm sorry, not Erickson. You have to know Freud. You have to know Carl Rogers, narrative family therapy. You have to know solution focus. I have to know feminist therapy. I have to know TA. I have to know existentialism. I've got to know these theories up, down, left, right, whether they're in an individual, a family, or a group. I just have to know them. And Tuckman's model, Tuckman is forming, storming, norming, performing, and then it's over. Remember, according to Tuckman, the first stage of cohesiveness is norming. I set the group rules. This is what you have to do. If you've been in session with me, you know your camera has to be open and you have to participate. That is a group rule. But many times when I'm teaching a prep course, a 15-week prep course, where now everybody's reached cohesiveness, there are norms. We know that Barbara's going to be late. I know that Mary won't answer questions unless I call on her. That is a normal part of the norming process, and that norms are different for each group. What I do know is the storming process will pass. It'll pass. Dr. Pam, you ain't done drugs. How can you teach this class? Or you know nothing about having your child taken away from you. How can you teach this class? So the storming, and sometimes Corey calls it the transition stage, and I believe y'all calls it conflict. Those are all part of normal parts of group process. So if we talk about product and process and content, all of those terms, if you're not familiar with, I mean, you might want to sign up for a session with us or watch our videos. Let us teach you. Okay. So again, if I'm starting over leadership, that's going to be in my storming stage, but it'll pass. Careers are on both questions. Again, it'll be a vignette question probably on the Ncmce, but in careers, which career theorist emphasizing matches personal characteristics with job environment? Oh, could that be trait and factor? Yes, it would be. It would be trait and factor. And for both tests, you'll get the vagueness, So most people, my clients say, I studied the theorist, but I didn't see anybody's name ever. You're right. You won't. You have to know the theory. If I talk about Super's lifespan, remember, that's the rainbow that talks about where you are in time and space. Are you a child? If your parents are still alive, you're a child from the time that you were born until the time your parents die. That's the role you play in the span of life. Crumbolt's learning theory. Remember, Crumbolt's followed Bandura. Crumbolt's talked about planned happenstance. He also, his instrument that he used is the career belief inventory. He wanted the counselors to challenge the belief system of the clients. And Rowe talked about fields and levels. She's one of our 2 women in careers. So Rowe talks about my field is based on whether I grew up in a warm home or a cold home. which is based on Maslow's theory, and the level many times described as Freudian or genetic. So if my parents were unskilled, I'll be in the same place. The way that I am sharing this information is the way that you need to know it for the test. That's why we say 90 days. 90 days. The way that you got through grad school of taking notes is not going to work for you. It's not going to work for you. We teach on the theory of neurotransmitters, right? We know that our brain changes and grows. Back in the day, when I was in college and high school, they said, this is your brain on drugs. And they said, if I did all these drugs, that I'd just lose that part of my brain. New research says that's not true. New research says that my brain is elastic. It'll change and grow. So our research, the way that we teach is based on our research, that if you really repetitively listen to us over and over and over and over and over again until you want to puke, until your husband and your kids hate you, you'll pass the test. So that's how we teach. And there's a reason why we teach the way we teach. We realize we are the new people. We realize that they're old white men that have been teaching the same way forever. However, our teaching is based on everyday conversation. It's based on people that have taken the test. And I ask them always, what did you see that I didn't teach you? We will never sell you a canned program. We do have a new ebook, an audiobook that's coming out, but it's going to be ever changing based on what the current theories are. As of this date, I hear people say all the time, there are 1,000 group questions. That's not true. It's just not true. The vehicle is group, but there are very few questions on forming, storming, norming. The questions are more based on, if I'm a narrative family, of a narrative therapist, what would I do in a group session? I just have to know my theories, up, down, left, right. Oh God, stats, Dr. Pam, I can't do stats. Yes, you can. On the NCE, there are about 30 questions. And on the Ncmce, you will not see any of those. But I will tell you, these are the easy ones. What we know is perfect correlation is 100. It's 1.0. Whether it's negative or positive, that's perfect correlation. So what that means is if the price of gas goes up and the price of eggs goes up at the same time, that is a positive. If the price of eggs goes down and the price of gas goes down, that's still a positive. That's a positive correlation. As long as they go down at the same rate of a 0.70, that's acceptable correlation. We're good. We're good. However, if I find that the price of eggs goes down and the price of gas goes down and it's below a 0.70, that's not acceptable correlation. The way that I teach it, if you remember that 100 with that decimal point over is perfect correlation, the least I'll take is a C. So 0.70 is the least acceptable correlation. So if the correlation between two variables, sometimes it's called bivariate, is negative 0.80, if I move the decimal over, I know that's a pretty good correlation. I don't care if it's negative or positive. I just know that's a really good correlation. So it's a strong negative correlation because they're both going down at the same time. Okay. Easy. Remember, correlation is never cause and effect. It's only about the correlation. If I'm doing qualitative or quantitative research, quantitative is numbers, qualitative is going to be correlation. Helping relations. Again, I'm getting so many questions this one. This is one of those counseling skills questions. A counselor reframes a client's statement. I failed my test into, this was one of the setbacks in your progress. This is an example of what? Did you see in the question that they used reframing? Many times it's a reading test. Now, reframing most often belongs to structural family therapy. Reframing means looking at it from a different viewpoint. Labeling means giving it different words, but many times they often still mean interpretation. So in this particular question, because it uses reframing, then B is going to be my best answer. So I'm not sure that this is the best test question that I would see, but I want you to understand that reframing and relabeling are still both types of interpretation. Paraphrasing is how you got through grad school. You put it in your own words. And reflection, which is almost always on the test, reflection talks about the feelings the client didn't say. Many times that's going to belong to Carl Rogers, no matter what test you take. And again, my assessment tools, the same kind of thing. I'll see that. So diversity, the same kind of questions. The counselor is working with a Muslim client, schedules sessions to avoid prayer times. What we want to be is culturally competent. I want to understand the culture of the client that I'm working with. But cultural competency is not one of my questions, right? That's what I want to see, but that's not there. Cultural imposition. Imposition means I got in the way. Ethnocentrism means that my ethnicity is the best. We can go back and talk about Piaget. He talked about egocentrism, right? In the SP, sensory motor, preoperational, concrete, and formal. In the preoperational stage, 2 to 7, kids learn that they're the best. Share with who? Egocentrism means my ego is the center. Ethnocentrism means my ethnicity is the center. Okay. And again, the same kind of theories as we go along. So you'll find that most of the questions are going to be the exact same. What you'll find is no stats and very little research on the Ncmce. You'll find the longer vignettes, and you'll find you get an initial session, a second session, a third session. But they're definitely always knowing the theorists. This is why you do what you do. You decide what you're good at. That's up to you. I love the Ncmce, but that's because I'm a clinician. I love to diagnose and treat. But I also think the NCE, especially when it comes to assessment and research, those are just memorization questions. I teach you those at the end. Either way, you have to put in the hours. I will teach you, my staff will teach you all day long. We will teach you everything that we know that's going to be on the test. But if you don't put in the hours of studying, you still won't pass. And if you're studying with us individually, you'll hate it when I say it, but my staff and I will say to you, you're not ready. You don't get to glance over it. You don't just get to know that the empty chair belongs to Gestalt or just here and now. You have to know the Gestalt is very directive. He's in your face. He's all about your feelings. You have to know content. You have to know figure ground. And the best way to pass any test is knowing content. We'll provide you content to study, and then we'll provide you with questions that are related to the test. We're the best people to give you the questions that are like the test. In the past, I've recommended Pocket Prep, but be on the lookout. You'll find an app soon that definitely just has questions that we have written that are most likely based on every test that you take. Hope that you found this video enjoyable. Hope you find me enjoyable. I'm going to say I'm still much more fun than anybody else you've ever seen, whether you're taking the social work exam, the NC exam, no matter what test you're taking, the CPC exam. I live with 2 dogs, and I'm pretty sure they don't speak English. So I hope I see you in a live session with me. I hope that you come to me and ask questions. Hit my brain. I love this. I love what I do. I think about this all day, every day. We're constantly researching, making sure we have the best of the best. So I hope that you're a world changer and you pass the test soon. Bye, guys.